Hi, everyone. My name is Dr. Melissa Richards. I'm an obstetrician gynecologist at Olmsted Medical Center. I'm also the division chair of hospitals and surgical services. And today I'm also the guest host of Pelvis Party. Becky and Brittany are off doing more fun things. No, not more fun things.
Yeah.
This is way more fun. I am sitting here right now with Nikki and JJ, who are both my awesome colleagues down in our breast clinic, mammography. And today we're going to be talking about some myths. We're working our way. October is always around the corner, it feels like. I feel like we're always seeing pink ribbons.
Pink.
Yeah, whether it's November or September, October is always around the corner. You know, when we talk about mammograms, breast cancer screening, I kind of wanted to talk about myths today, which is kind of interesting. I hear a lot from patients kind of asking me questions, and it's so fun to have you both here because you see so many patients every day. If you don't mind, just kind of introducing yourselves and what you do at Olmsted. Nikki, you want to start?
Sure. I'm Nikki. I'm in the breast care center for the last 21 years.
21 years?
Yes, I've been at OMC that whole time.
That is amazing.
Yep. I do mammals most days, and then I help JJ in our office, call back patients and guide patients through their journeys.
Fantastic. And JJ?
JJ, I am a nurse in the breast imaging clinic at OMC. I just started in June of this year.
Welcome.
Thank you.
You're doing a great job.
Thank you. Thank you.
Absolutely.
But I've been a nurse for 12 years. Prior, I was at Mayo Clinic. And I have had my own breast cancer journey myself. So, I feel like I have a lot to give these patients.
Absolutely.
Perfect fit for us.
That's fantastic.
Like, I'm very passionate about it. So.
I can tell. I can tell. It's going to be so much fun to learn a little bit more about you, whether it's on Pelvis Party or at OMC.
Right.
We get to see you.
Right, exactly. I've walked by your office multiple times, and I'm like, oh.
Yeah.
There's a lot of fun stuff in there. You should just come right in.
I will.
Yeah.
Fantastic. So when we talk about myths, I think a really common myth is like, I don't need a mammogram because, well, no one in my family has breast cancer. Why would I need a mammogram? When I have patients say that, what do you two think of when patients come in and give me that kind of those thoughts?
Yeah, wrong. Most patients that get diagnosed with breast cancer have no family history.
A lot, right?
I had no family history. I turned 40 and I was getting bombarded with these messages. You need your mammogram. You need your mammogram. I'm like, nah. And I didn't get my mammogram when I was 40. I didn't get seen, and then I got seen when I was 41, and I'll go into that some other time. But yeah, it's very important.
And when we talk about mammograms, I think one of the confusing parts can be like, when do you get your first mammogram? At OMC, we typically recommend based on normal family history, normal risk factors every year. So, and I've been very open about my own mammography journey that I was a year after when you got your first mammogram. So I turned 42 last year, and through some very helpful teamwork at OMC and encouragement, and had a fantastic experience. We are just the best patients. And if you on Instagram, you can actually watch my journey getting my mammogram. And it was great. It was awesome. I felt like taken care of.
That's what we want there.
Absolutely. And very successful in that. Do you think like other things I hear patients ask about are like other types of imaging? Maybe I saw it on TikTok or Instagram, like thermograms. I, as a clinician, I really don't know what a thermogram. Have you heard patients talk about thermograms before?
Yeah, there was a while when that was like a hot topic, and we had to actually like make a little sign and put out that we don't recommend that. The recommendation is still your annual mammogram, self-breast exams, just the usual.
And how about patients who maybe have different risk factors, maybe a family history of breast cancer? I've heard patients say like, well, I get my mammogram every year. That's good enough, right? What do we have out there?
Not quite, yeah. We're starting to do more contrast enhanced mammography. That's a really cool tool because it's a lot cheaper than a breast MRI. Breast MRIs are kind of expensive, but they are still the golden ticket for those high-risk patients. And we can do the breast MRI right at OMC now, so that's great.
Awesome.
Yeah. And we are working on trying to develop our high risk program better. So we're going to be contacting you if you're at high risk. We're going to be contacting all the patients to try to get them in for
Nikki or
that MRI.
myself,
Yeah.
for sure. I think what's important is with these high risks, they like to stagger those out. So your mammogram, and then 6 months later, you would do an MRI kind of thing, or our contrast enhanced mammogram, and we like to have, all of the financial stuff too down as well. So we usually try, I think, to book them out like 2 weeks, so then they know what their costs would be to get an MRI, because that's not fun to be surprised by that either. And that's probably one of the reasons why women don't come in, because of the cost. But I know all screening mammograms should be covered.
Yep. Most insurance will cover either once a year or once every 2 years.
Yeah. So it's unfortunate that we have to get into that part of it, but it's reality. Yeah.
Yeah.
So
absolutely.
Yeah.
So that can be discouraging, but
and then let's say we are having, financial difficulties. I think there's a myth that says like, well, then I can't get my mammogram done. I know that I have patients who have participated in different programs like the SAGE program.
Yes.
That's a wonderful program.
Yes.
It's a great program.
Yeah. We do have a lot of patients that go through the SAGE program. We even have one right now that needs a breast MRI, and I hear it's getting covered.
Fantastic.
Yeah.
And I think it's just a great opportunity to talk about like resources. It's frustrating to me when we have resources available, but patients just don't know about those resources that are out there. And that's why we have people here like JJ and our social workers and advocates, even in conversation with patients. I don't think I've always realized every touch point that you have when you walk through a hospital, and for us at OMC, everything that comes out of our mouths, whether you're the physician or the mammo tech, everyone, those little moments matter. So bringing that up to a patient, like, well, are you interested in talking to our social workers because we might have some programs available, or did you know about this? It's just really helpful.
Yeah. Having education available is a big deal.
Yeah. And it's having you here, JJ, is just such an asset, and it's going to be so great to watch as we
thank you.
keep moving and developing more and more programming at OMC to take care of something that affects so many women.
And it's very treatable.
Very treatable.
If it can get caught early, it's very treatable. We just need you to come in, get that first mammogram, and then come back and see us every year.
Absolutely.
Yeah, honestly.
And I promise it is a wonderful experience. I felt like
it's not that
just
bad,
so
right?
supported, and everything was explained so well. And it's just a beautiful space. And I cannot find probably the perfect words to express my gratefulness to be able to call both of you colleagues. And I'm just really happy to have you both here sharing what you know and debunking just a couple myths and letting us learn a little bit more about both of you. If you'd like to learn more about Pelvis Party, please go to rochesterlocal.com/pelvisparty.